Good evening, I'm Donna Bush with your CIG-TV News Brief and weather forecast. Recently on Cayman Brac, over a 3-day period, 61 green invasive iguanas have been culled by the Department of Environment. DOE Research Officer Jane Hackison says the problem is getting worse.
We're here to try and stop the spread and have been for several years, but this year is by far the largest catch that we've ever had from this area. So the density is still low enough that you don't regularly see them, but they are here. So every now and again you will come across them, but they are really here in pockets. So we know which areas to target, but we do need to do so, and we need to do so rather fast. Also right now we have, as the Department of Environment, been coming over, say, quarterly to help with stopping the spread, and we have a local community here that's very much aware, and a group chat, so we do reportings and we answer all of those reports where we can. But yes, it's definitely time, I think, for us to think more strategically about how to stop the spread of these animals, particularly because on Cayman Brac you have a very different type of environment. So you have the bluff, which is extremely difficult to traverse, let alone, spot the animals there. And we know for a fact that we have large males up in there that are reproducing now annually. And largely what we're catching now is the produce of that. So we're getting a lot of hatchlings.
The Department of Environment has been fighting the invasive green iguana here on Grand Cayman since 2018. On Friday, we told you about a meeting between the Department of Environment and water sports operators, where the impact of the Stony Coral Tissue loss disease was discussed. So far, the disease has affected 8 miles of coral north on Grand Cayman, and the experts say the rapid progression of the disease over the 8-mile area can be due to many factors, but they don't know the direct cause of the coral diseases yet.
The appearance of this disease is similar to other types of diseases in the way that it's rapidly losing tissue, but it happens a lot faster than other diseases do. So it appears on a coral structure as focal or multifocal lesions, which just means that it appears in one part of the coral, or it can appear in multiple areas of the coral. The progression can be up to 4 centimeters today. So like's been said already, it is a lot faster than other diseases in the region. Researchers have been unable to determine the cause and the method of transmission for this disease, but its evidence suggests that it's a bacterial pathogen that is transmitted by touch and in the water column. The reason that they feel that it's a bacteria is because they've had some success in different regions with antibiotic treatments. And they know that if 2 corals are touching each other, it could jump from one coral to the next, and they know that like if you put 2 corals in a tank and one's diseased and one is healthy, the other coral will get infected because it's in the same tank as another one. So
the DOE is taking a multi-pronged approach to the intervention of the disease, including removing diseased coral, monitoring the spread, and considering closing dive sites in diseased areas. Well, the 11th annual healthcare conference was not open to the public this year, but was held virtually instead. The theme this year was re-envisioning life with a pandemic. It was a topic discussed by the various experts who attended. Minister for Health, the Honorable Dwayne Seymour, reminded the public to go to the right sources for their information on COVID-19.
We have only been fighting a virus for the past 8 months, but we've also had to combat streams of misinformation and misperceptions, both about the disease itself and our efforts to suppress it. With so many channels of communication and news gatherings available to us locally, regionally, and globally, it is easy to get mired in information and overwhelmed with data, some of it false and dangerously misleading. It is important that we separate ourselves fact from fiction.
During the panel discussion later in the afternoon, where various persons from the community, including doctors, nurses, and community activists, were present, Deputy Governor Franz Manderson shared with us one of the things that made him most proud since COVID-19 cases started to be reported in the Cayman Islands.
One of the things that was constantly on my mind when we were in the NUOC and we were hearing around the world about how vulnerable persons, the elderly, were dying. And I think that used to stay on my mind, and I used to tell the team, every morning, top priority, care for our elderly. And I was very proud until today that we have kept our elderly safe. The work that the Children and Family Services did in preparing our rest homes and place for the elderly, keeping those places safe, the work that the people at the Pines did.
And for your source of information on the COVID-19 pandemic, you can go online to gov.ky. Of course, you can watch the entire healthcare conference on the CIG television YouTube channel as well. Turning now to our local forecast from the Cayman Islands National Weather Service. Today's high temperature reached 89, the low 78. The forecast was for cloudy skies with a 60% chance of showers, and some thunder. Showers may be locally heavy at times. Now, the winds are from the east to southeast at 10 to 15 knots. Seas will be moderate with wave heights of 3 to 5 feet. A tropical wave is making its way across the western Caribbean. It's expected to produce scattered showers and thunder across the Cayman Islands area for the next 24 hours. Radar images show scattered showers in and around the Cayman area, which are moving towards the southwest. For more on local weather, you can go online to weather.gov.ky or download their app, CINWS. That ends today's news brief here on CIG Television. I'm Donna Bush. Have a great night.